Your age is going to be an aspect, and if you have multiple people, the ages of the first 5 people in your family. If you have more than 5, you don't, you get some freebies at the end. Tobacco is something that affects premiums or is allowed to affect premiums. I will say that we are not surcharging for tobacco, and that was a very conscious decision. I'll talk about that in a few minutes, but we are not going to put a surcharge on for tobacco in an effort to really make sure that people say, yes, I'm a tobacco user, and how we can help people get healthier. And if you qualify, the advanced premium tax credits help mitigate the differences in these premiums, and I'll show you how that works. So yes, if you're in Aroostook County, your premiums are going to be higher than if you're in York County. But if you're eligible for the premium tax credits and you're only responsible to pay a percentage of your income for your premiums, then that difference goes away. These are just some of the premium scenarios. These are monthly premiums without any subsidies applied for some of our plans, and just some different scenarios based on age, you know, somebody with a child, somebody who's single of one age versus another age, and a family with 3 children. And the differences, again, these are, Cumberland County has the lowest premium band ratings. The differences are largely due to the cost of healthcare in these different rating areas. So the advanced premium tax credit, there's this new refundable or advanced premium tax credit. People don't have to take it up front, but they can choose to, and I'll tell you how that works. Eligibility is based on household income and family size at the end of the year. If your income is between 100 and 400% of the federal poverty level, so you'll hear people refer to an FPL, that's the federal poverty level. So that for a family of 4 this year would be between $23,500 and $94,200. That is a lot of people here in Maine, so who will be eligible for these premium tax credits. You have to obtain your insurance through the marketplace. So again, there'll be 2 insurers on the marketplace. There will be other insurers you could choose, but if you want to get the subsidies and you're eligible for them, you'll have to go through the marketplace and make a choice among those 2 insurers. Not all the insurers here in Maine chose to go into the marketplace this year. It's likely that more will choose to do so next year. And then you can't be eligible for government-sponsored coverage. So if you're already eligible for MaineCare, the Medicaid here in Maine, if you're already eligible for Medicare, if you're already eligible for another program, or if you have affordable employer-sponsored coverage, you can't get the subsidies. And there are a couple of exceptions, we'll talk about that. But, or if your plans, if you don't have, if you have other minimum essential coverage, other plans that you're entitled to, for example, through a veterans program, this is to really augment some of those government programs and employer-sponsored programs. This is just to give people a sense of what the federal poverty level guidelines are, so people get a sense not just for one person, but for, you know, families of 4, families of 8, etc. And the advanced premium tax credits for workers. So we talked about the fact that if you have an employer-sponsored plan, that is, what the 2 words are, if it's credible and if it's affordable, you're not eligible to get subsidies on the marketplace. You can always choose to opt out of your employer plan and look and see if there's a better deal for you on the marketplace, but you're not going to get subsidies if your employer is offering you a plan that is credible and affordable. This is the first bullet here, the employer-sponsored health insurance plan. If it doesn't meet minimum value, it doesn't pay